Okay, let's go ahead and get started for actually our last session. If you can find your seats, that'd be great. I know a few are still milling in the hallway, so we'll hear some slamming doors. But the last portion of our program today, as I said before the break, we're going to start off from the veterinary side, looking at antibiotic use, other animal health issues that might be on the horizon that could affect our production. We're very pleased to have Dr. Keith Roehr, who is our state veterinarian for the state of Colorado, here to talk about that. He talks about it around the country, so we thought we ought to go ahead and have him talk right here. So appreciate Dr. Roehr being here, and his topic will be only 30 minutes. So we'll be, if you see me waving, that means it's time for questions. Otherwise, he may be asking you questions along the way as well. So, Dr. Roehr, thank you.
Thank you, Dr. Pond. Well, good afternoon, everyone. Thank you for the opportunity to visit with you. I grew up on a farm ranch in southwest Kansas, became a veterinarian in 1981, came on with Department of Agriculture in 1995. And what I'm going to talk with you about this afternoon has absolutely nothing to do with my day job today. We don't regulate antibiotics. About everything I'm going to talk with you about is just things I see, and it's my visceral response as a agriculture person in what we do and the way I see this changing and what's involved, that I think it's very interesting, it's very confusing, and it's changing day by day. It's changing very rapidly. So with that, what I'm going to talk about this afternoon: antibiotic use in livestock, a little bit of history of what has happened in the last several years, what is the current use and why do we use antibiotics, what do we use them for. Second, I'll talk about the Veterinary Feed Directive, but really what that's part of. The Veterinary Feed Directive is part of the judicious use of antibiotics, which is a bigger realm that FDA is involved in. I'll talk a little bit about why did that come about, what does it mean, where is that going in the future. And then last, public perceptions about antibiotic use and food safety. And part of that is way stranger than fiction. And yet part of it, I think we can understand. There's been a lot of good information here about how to respond appropriately to things that we hear and take opportunities to have our 5-minute discussion with people when we mill and integrate with people in a public forum. So an antimicrobial timeline. And what we have here, as you see this progress, these are all the antibiotics for veterinary medicine and human medicine that have been created. And one thing you'll note, and then the red oval are all the products that are available for veterinary use. And a couple things we noticed: the first product for veterinary use were our sulfonamids, and came on in 1935. Gary Smith described a couple of relatives that got brucellosis. My grandmother got brucellosis, and what was she treated with? A sulfa drug. And at the time, it was actually not a licensed product, it was experimental. It didn't cure brucellosis, but it sure made you feel a lot better to take the bacteria that got in your system. When it got systemic, it made you feel really bad, and you had fevers, undulant fever, and it helped tremendously to treat that. Another antibiotic that we were all familiar with, and this was a cause and effect thing for me. When I was a kid and I had an earache, I knew that what was fixing to come hurt a whole lot worse than the earache. And what was that? It was a shot of penicillin. And there was a cause and effect principle, because I was going to go to the doctor, and you got one injection of penicillin, and the earache and the ear infection was gone immediately. And it isn't necessarily resistance. It was just a naive population of bacteria that were susceptible to that product. Penicillin still has some application and use today, so resistance isn't universal. And then on up the line, chlortetracycline, we'll talk about the primary use of that is in feed and a lot of different uses. Some of you may remember the day of chloramphenicol. You can't use chloramphenicol at all. And people, if people take chloramphenicol, it can cause an aplastic anemia. It can wipe your bone marrow out and you'll die. So that product has very little use, but historically it did. And I remember when I was in veterinary school seeing that product used. And yet we look up this line, and some of these drugs today are silver bullet drugs, virginiamycin, and yet was created in 1959. Cephalosporins and these two classes comprise our silver bullet antibiotics for the most part in animals today, and yet the last one came online in 1978. And then these last two products or product lines are not even available in veterinary medicine. Those are reserved for people in human medicine. So the point of this is all there is. There's nothing else in the pipeline. This is all that we think we'll have in the future, so we understand being good stewards of these products is important. Because we all realize if you're ill or if you have a problem and you're in a hospital, you want something that's going to work, and yet we'll talk a little bit about resistance. Resistance has a number of different causes, and it's not simple. But we're still charged to use appropriately and judiciously what we have access to do with today, and we're going to be watched and we're going to be monitored. We are today, and we want to do right with what we use. We want to do right with the animals that we're entrusted in their care and keeping. So this is an interesting graph, and by the way, that last slide, this slide, and the next slide are compliments to Mike Apley. Mike is a pharmacologist at Kansas State University. This slide talks and shows, here was the introduction of penicillin, the first clinical use of it, and 7 years later, a documented case of osteomyelitis or a bone infection with a penicillinase producing Staph aureus. So it took 7 years for the bacteria to figure out how to deal with this and develop resistance. Same issue here. First use of ampicillin 4 years later, a penicillinase that would work against ampicillin, and so on. I think the point is we all understand the things that we're charged to do, and particularly as private practicing veterinarians, that you're to prescribe a product that is the appropriate antibiotic that is effective against the bacteria you're treating at the right dose, the right route of administration for the right period of time, and then paying attention to withdrawal dates. All that's important in judicious use, but to prevent the creation of resistance in antimicrobials. Yet, the other thing in this process that I think may have had as much to do with this history as inappropriate use or overuse are things like plasmids. And do you all know what a plasmid is, you young folks? A plasmid, and I'll give a rough definition, and y'all can correct me if I'm wrong, but it's a genetic element that can replicate and copy, and yet it does not have to do with chromosomes. So within a cell, it can replicate information, and in this case, where they're bad is they replicate information and they say, bacteria, friend of mine, if you want to beat penicillin, here's how you make penicillinase. So the best way to think of them, this is a thumb drive, USB drive. So plasmids are like little USB drives that exist in microbes that copy information, and then they share that with their buddies. And they can even share it with different classes of microbes. And I think a fair amount of resistance probably was going to happen irregardless of how we used products. So I'm saying it's not necessarily misuse that creates resistance.
Is that horizontal gene transfer?
Horizontal gene transfer?
Is that what you just described?
it is not the transfer of chromosomal information, of genetic information that has to do with phenotype and genotype. It's information within a cell that is essentially inherent to survival. Whether it is horizontal because it transmits between different species or the same species of bacteria. So I had an opportunity to go to Africa, and I saw livestock over there that had never seen an antibiotic ever. And in treating these calves, this calf right here, you can't see down low, but he's got a bottleneck, and he's in such a degree of pneumonia that he's a little bit like a brisket calf because he's got heart failure too. But this antibiotic that I'm fixing to pull up, this calf has never seen, and yet I will tell you the day after I gave it, the calf didn't survive. So obviously we know there's a lot of different issues there, and there's no silver bullet. And we all know the same thing, that there's a lot of different things you need to have, like a competent immune system, that this stuff in a bottle, while it was at the time for us, it was a modern miracle. And so were vaccinations. I mean, polio vaccine was a tremendous, wonderful thing, and we, God bless Dr. Salk for creating that. And antibiotics are a wonderful thing, but they aren't a panacea. Neither are vaccinations, totally. But in this situation, it was interesting. The Maasai like seeing this stuff because they don't know if it's magic or what it is, and all they just want it. And they also know that this stuff works on them, and if they get sick, they want medication. And I couldn't tell them I was not a human doctor, so they told me what I tell them is I'm Dr. Longishu, which is a doctor of animals, and they said, we don't care. We just want some of that, because if they were sick, they knew that might save their lives. So, and here's a good illustration. This is treating a cow with a problem. You can see her physical condition. Look where my thigh is. It sinks in beyond her rib cage. We're in the middle of a drought, and this stuff just didn't work over there. So that cow perished. She didn't have an infection. I'm just trying to do what I can. There's no diagnostics. There's no D-labs. There's no other resources for these people. And the next time you think you're tough, work cattle wearing sandals and no squeeze shoe. I just threw this in. I thought this was interesting. I was going through my slides. What are these? It looked, I thought when I first saw it, it looked like Michelin Massage or Goodyear Grind, like RBC or Hit by Car, HBC. They're brands. Maasai brand their cattle, and they actually take it as an art form. So they don't brand them with a unique brand that is ownership. They just brand it, and they know, I've got a cow that looks like this with a little sun on her cheek. They do that with just a clothes hanger and a hot fire. So this is antibiotic use in 2010 by class. And if we look through here, first I'll pick out what do we need for the silver bullets, because if you talk to feedlot consultant veterinarians that know their stuff like D. Griffin, he'll tell you he's only got 3 antibiotics in his arsenal. That's all he needs. And those classes are here, the fluoromphenicol class, the septiofur class, and then 2 within the septiofur class. But that's all they need. But yet, we look at use, and there's about 11 million tons a year of tetracyclines that we feed primarily through feed and water to livestock. I think that's a little bit mind-boggling. I imagine you could put a ton of product on a pallet, but still 11 million pallets would probably be enough to go from here to Denver. That's a lot of stuff. If we look at just what we use in tetracyclines and ionophores, monensin, that's 70% of the total antibiotic that are received by animals. What I'm going to propose or discuss is that we rethink what we do with these products, because your veterinarians, what D. Griffin and Del Miles will tell you is when you feed this tetracycline, it is not at a therapeutic level to kill a microbe that causes a specific disease. It may have very real preventative qualities, but it's not because it's killing a specific bacteria that's present at the time that you're giving it. What we really think is that these products mature the gut, so we put them in products and rations around the time of weaning, and it matures the gut and it gets that gut ready for feed, and that calf, instead of being weaned, is kind of bumped ahead a week where it transitions to a ration more effectively, and it prevents disease. It does. But here's going to be the interesting issue. The Veterinary Feed Directive says that when a veterinarian prescribes a product through that Veterinary Feed Directive, that document is for a specific use in disease prevention. It's a pretty wide claim if you just say, well, it transitions them to feed better and thereby preventing disease. That extra step, I don't think FDA is going to buy. So I'm going to talk a little bit about that decision-making process and who's involved in that and how we ought better do that. So if we look at what the bigger issue, again, is judicious use of antibiotics, and we all agree that it's the right thing to do. We have access to those products. We want to use them appropriately. We want to use them with some common sense, and we want to use them for the betterment and the welfare of the animals that we're treating. And I think the greatest majority of what we do, that is accomplished. So in the end, what is the judicious use and what is the Veterinary Feed Directive? It's greater oversight. There's no question. This is a rule from FDA requiring veterinarians to do paperwork, for the use of feed and water use. It has nothing to do with injectable routes at this time. But I'd say we should all perform well as a community to perhaps at least extend the time to where other routes of administration may be included in the future. Why did this happen? It's clearly there were international pressures and concerns from the OIE, which is the equivalent of the World Health Organization for people. It's the Office of Infectious Epizooties. It's a group of animal health officials across the world that agree together on how to do things. We were one of the only nations where you could go to a feed store, buy a product, put it in feed it to animals with no oversight. Now, I'm not advocating that every product is by prescription from a veterinarian, but it will be a community decision as to how those products are either mixed in feed or put in water in the future that I see not as an impediment, but really an opportunity for conversation to help us all do better at what we do. So again, how is through the feed directive, and then when, less than a year. And some components of this are already in place. I'll talk about that here. How will the FDA measure effectiveness in the changes? This one's already happened. They gave drug manufacturers the opportunity for a streamlined process to change labels. And a lot of this was changing labels away from growth promotion and other products. A lot of it was just clean up to make those labels more accurate. I'm sure it was complicated, but FDA made that, and a number of manufacturers did exactly that. So when they measure effectiveness by that, they did it. The other issue is reduction in use. And we saw the table where we see 11 million pounds of product used annually. FDA will go back and look. I think it'll go down merely because there's oversight and there's red tape and there's work to do to use a product. And I get that. No one likes red tape and stumbling blocks. Yet what I hope, and here's my point, if we have a conversation between the different entities involved in that decision and results in a reduction of use, that's great. If it doesn't, that's okay too, because if we verify that we're using the product according to this process and we still use the same amount, that's okay. But FDA will be watching this. This last thing, they say they're not looking at this, and they truly are two separate issues. But I'll tell you, this one's exceedingly important, and residue violations are just something that we need to work together. There's certain livestock sectors where they're more common, and there's some that are just need to go away. The use of banamine in dairy cattle by any other route than IV administration, intravenous, will cause a residue, and they find it. If we want to lose products that have value in treating, particularly those that are pain relievers, that are anti-inflammatories, like banamine, just continue to use them inappropriately and we'll lose product labels. So the residue issue is one that I talk about. And again, my office has nothing to do with any of this. This is just my observation. So this is the community. This is the discussion that I'm describing. And who is it that plays the decision role? And the producer owns the livestock. They're certainly involved, and the veterinarian has some decision-making in that. And now we have a VFD, a Veterinary Feed Directive ruling, and the feed mill will build what you want them to make. But today, the nutritionist probably has more to do that, according to these guys that I talk to that are consulting veterinarians. In the future, and I'll show you another slight change to this puzzle that I think is an opportunity in the future to look at things a little bit differently and maybe do things a little bit better. So again, what are the drivers? OIE pressure. This one's kind of come and gone. We've done what probably for now satisfied that through the FDA regulation, but probably what a number of people fear more than that is a presidential directive. And the president and Mrs. Obama had a lot of influence in the National Institute of Food and Agriculture, NIFA, and they looked at childhood obesity and a number of other issues, and this is one that they've looked at, and a lot of people were and still are very worried of what might come down that's not a regulatory thing, that's just a change immediately. And time's running short in this administration. Hopefully, that's not something we'll see. Again, the residues, and this is the last one. And this is where I'm going to shift gears to the last part of my presentation. But the public sentiment is something that changes rapidly, and in a way it's hard to predict, and yet I think there's a lot that we can do in the future to work together to affect how we do. So I go in restaurants and I read stuff, and I see how they advertise fast food. And the one this is a Colorado company, and they use Angus beef, humanely raised, strict vegetarian diet, no steroids. And of course now they say growth hormones. I don't know of anything that uses steroids like weightlifters, so that's crazy. And no antibiotics ever. So I don't know what verification that went through, but that's where they get it. Here's where they get their chicken. It's all natural, responsibly raised, and antibiotic-free, and that's where they get it. So it's what works for them to use. So how many of y'all heard about this, the CNN report? Yeah, crazy. So we get this, and look at this statement. Livestock producers use antibiotics routinely in their flocks and herds. That's true, right? Okay, bacteria can develop resistance. We all know that's true. But they're in the same statement. That can spread to even larger communities. Yes, it affects human health too, but whether that's from these guys I'm not convinced of that. Contributing to a larger problem of antibiotic resistance. When you put all those statements in a row, you're building a case. They're making a lot of assumptions, and they're leading people down a path. And then this one's over the top. The worsening of the epidemic of resistance. Is there an epidemic of resistance? No. Do we have a finite number of antibiotics to use? Yes. So we are concerned about that, but I wouldn't call it an epidemic. It means that antibiotics may not work when we need them most. There's a number of reasons why they don't work, and it's not always a fault of the antibiotic not able to kill bacteria. You got to have an immune system. You have to have a number of other things that work correctly. But this one's the over the top. If our kids contact methicillin-resistant Staph aureus, or our parents get a life-threatening pneumonia, now this stuff isn't going to work. And if you trace back to the previous comment, this is where it starts. So this kind of stuff, it's over the top, it's mean-spirited, it's not constructive. You know, and I guess we asked the question, how do we deal with this? So they went on and they said, well, let's do a scorecard. And they came up with this, and they said, well, Chipotle and Panera Bread get A's, and Chick-fil-A gets a B, Dunkin' Donuts, and then everybody down here got an F. And, you know, they're talking about antibiotic use and transparency, and right now these guys got problems of their own. But so how do you deal with that? And I think this is the answer to me. So about a week after that comes out, I'm reading this, and Dan Thompson says, I've had a hard time accepting the fact that a CEO in a boardroom, and you know who he's talking about CNN, has not taken time to engage and learn about our industry and be allowed to make a snap decision regarding veterinary medicine and beef cattle health in the name of responding to activist groups masquerading as consumers. Well put. He's got the right message. He goes on to say, we continually to improve the best system for judicious use of antibiotics in the world, including programs such as AMDUCA, Beef Quality Assurance. Pat talked about this morning. Antemortem and postmortem inspections, those don't exist to the level that they do in this country and a lot of other countries. We got a great system. Is it perfect? No, it isn't. But it's the best, I think the best, what he says, it's the best in the world. And we're moving forward with the Veterinary Feed Directive. So this statement here I thought was good, and particularly right here. While providing these health programs for our cattle, this is what I agree with. We need a system in which people at all levels of the industry, and I'd say not industry, I don't like that word, all levels of livestock sectors or within the system, they're farmers and ranchers, communicate with one another so everyone understands the risk and unintended consequences of making decisions without due diligence. So I see this as an opportunity today to maybe rethink of some of what we do. So the last thing, there's a lot of weirdness out there today, and I found same thing. I read some stuff every day. Steve Bratman, he's some sort of physician, and he's coined this term, orthorexia. Ortho is correct. Rexia means appetite. We all know what anorexia is. It means no appetite. This is a correct appetite, and people have ascribed a way of thinking where what they've really done is, in an effort to be healthy, they've really become more righteous by their eating. And it's become legalistic, judgmental, isolated, and even crippling. This is a physician's observation. And further, this is the parent that he's talking with this child with a disorder. She doesn't eat grains, doesn't eat anything comes from an animal, so I guess she's a vegan. Eats only things that are raw, and pointing at a plate saying she wouldn't even eat this. And here's a physician that's dealing with these orders. I really like what Gary said when he was talking with his daughter. Eat whatever you want to, but let's talk so we can figure out that you'll get what you need and get a balanced diet. So one's not right or wrong, and yet there are people that are ascribing a greater sense of self-worth or righteousness from decisions that they make. So back to this. Before, what we had was the nutritionist in the center, and what I'm advocating is the producer, the nutritionist, the veterinarian, and the feed mill really gather as a livestock community to begin to talk about some of these issues and look at some of the use we do today. And if it lines up with the Veterinary Feed Directive, and if it's appropriate, then by all means do it, for the welfare and the well-being of the animals whose health we're entrusted with. Last thing I'll leave you with, the veterinary, or the Farm Foundation has a meeting Coming up 1 week from today, it's about this whole issue with the Veterinary Feed Directive. It's at National Western, 9 to noon in the Beef Palace, and they're going to focus on this, a very low-level discussion where you can ask questions and figure out what does this mean to you as a producer. So a great opportunity. It's here in Denver. And any questions? Yes.